Hello, I'm Lucy Morgan and I'm a lung doctor working here in Sydney. I was the inaugural chair of the Australasian Bronchiectasis Consortium and the Australian Bronchiectasis Registry Project. But today I'm speaking as part of the authorship team for the Thoracic Society of Australia and New Zealand, the TSANZ, position statement on chronic suppurative lung disease and bronchiectasis in children, in adolescents, and in adults in Australia and New Zealand. Chronic suppurative lung disease and bronchiectasis is widely regarded as one of the most neglected of respiratory problems, but it's really common here in Australasia. Since the last TSANZ position statement was published in 2015, our knowledge and our understanding of the evidence for what works to help patients with bronchiectasis has expanded considerably, and it was a really good time for us to update our official documents. This position statement was the result of a systematic literature review by a multidisciplinary team that included patients and clinicians from primary, from secondary and tertiary care. There are 33 statements in this document. 4 were unchanged, but 28 were modified on the basis of a change in the evidence, and there was 1 new statement. One important advance in this document was the recognition that with optimal care, early cylindrical bronchiectasis is potentially a reversible pathology. Another was to identify that taking a treatable traits approach to the assessment of bronchiectasis would address the heterogeneity of bronchiectasis and strategically look for traits that could direct us to a more targeted therapy. Examples of this include eosinophilic inflammation, immunoglobulin deficiency, bronchodilator response, fatigue and exercise intolerance, and the frequent exacerbator phenotype. Since the last position statement, Australia has a new bronchiectasis specific DRG, or diagnostic related group, that recognises the significant prevalence, direct and indirect health costs, mortality and burden of illness associated with severe pulmonary exacerbations. Australasians with bronchiectasis continue to be burdened by late diagnosis, by inequity of access to optimal clinical care and evidence-based treatments, as well as clinical services. Many of the updated statements in this document reflect the evidence for interventions that have been shown to reduce exacerbations. These include macrolides as maintenance therapy for more than 3 months. This is described in Statement 14. The second is inhaled antibiotics, again for patients who are having frequent exacerbations, particularly those with Pseudomonas aeruginosa colonising their airways. This is described in Statement 15. And for those with exercise intolerance and, again, heavy burden of symptoms and frequent exacerbations, the evidence for pulmonary rehabilitation and airway clearance strategies is outlined in Statement 21. This position statement also draws attention to the resources available to help patients and clinicians to achieve optimal lung growth in children, to preserve lung function, to minimise pulmonary exacerbations, to prevent complications and disease progression, and to optimise quality of life. There's much in the pipeline for patients with bronchiectasis, and we anticipate that there'll be another update to this position statement in 2027. Thank you.